Okay, so welcome everyone to the June South Florida HHRA virtual meeting. So this is our first time doing a webinar, and we were excited to be able to keep the momentum going and offer you some great content and training, have a chance to everyone to speak with each other and really just talk on what's going on and some of the topics that are very relevant right now out in the workplace. And we're going to really focus specifically on hospitality today. So I don't know if Freda, if you have anything that you wanted to say to get started or any opening comments.
Just welcome everybody. It's kind of great to, I can't see anybody at the moment, but it's great to sort of see everybody and at least get together virtually. And I'll leave off the membership comments because I'm just gonna.
Okay, so a couple housekeeping. So I'll just repeat a couple things that there is a chat box and also a Q&A feature. So if you want to post any comments or questions in the chat, we will be monitoring throughout the session. Leonie will be keeping track of it and making sure that we answer all of these questions as we progress through this training. Also, we'll have a poll that we're going to initiate in a second here. And we are planning to put this recording on our website. So again, we're going to record this and have this viewable for any colleagues who may not be able to make it today. So I guess let's begin with the poll. So we wanted to ask this question to all the members just to first get an idea of first, whether is your property currently open and what is your occupancy rate? So I'm launching the poll right now. So let's see, this is my first time doing this. So hopefully I get this going. So it should have popped up on your screen. And you can now respond to the questions. Let's get an idea for what the occupancy is right now, and even if your property is currently open. Coming in. And again, if you're not with a hotel, it's fine. You don't have to answer the questions, and it's no issue. Give it a couple more seconds. Let some more people participate. Okay, so from what it's saying, it's a little more on the no that the properties are not open, and 0 to 10% mainly because if currently the property is not open and there is no occupancy. There's a couple here, 10 to 20, 20 to 30, 30 to 40. So really no one has occupancy higher than 40% currently. So really we are still in the very beginning phases of reopening, and it just shows that, yes, we're still not there where we have close to full occupancy. I'm going to end the poll there. Okay, so I'm not sure. Hopefully that ended it. Stop sharing. Okay, so let's begin with the presentation. So Freda, what I'm going to do is, and Olga, for now, let's mute your audio, and we'll start by just going through the content. But if anything comes up, you need to interject, feel free to unmute and have the audio, video, and we'll be able to continue the dialogue. Let's see if I can get this to work here. Okay, so the topic today is we're going to be discussing returning to work during COVID-19, specifically in the hospitality field. My name is Zachary Rosenthal. I'm with Physicians Health Center, and I've been a board member in the past. I'm the vice president and an active member of the South Florida HHRA. And I wanted to put this together because I feel like this is a very important topic that we need to discuss and as peers really benchmark and review what we are all doing currently to reopen our hotels. As we've seen, really only about 50% of the people in the room have operations at the facilities right now. But many of you are in the process in the opening phase, going over the regulations, determining what is necessary, what needs to be done to open and keep your employees and your guests safe. So I'm joined here today by Sergio Casiano Jr. with MKRS Law, and he's going to be co-presenting with me and giving you more of the legal aspects to reopening your business, what you can and can't do. So Sergio, if you want to give a quick introduction to yourself.
Good afternoon, all. Like you said, my name is Sergio Casiano. I'm the chair of the Civil Liability Department at MKRS. We primarily almost exclusively handle workers' compensation and employment and labor. The workers' compensation side is generally on behalf of management. The employment and labor side can be both on behalf of management or the individual employees. And we are 52 years young now. So it's a pleasure to have you all here. I look forward to answering all your questions. And if anybody has any questions outside of this, please feel free to reach out to me and I'll do my best to answer your question.
Thank you, Sergio. So I'll just give you just a quick introduction to my company, which many of you are familiar with. If I can get this PowerPoint to work. It's loading. So I just wanted to start by just quickly stating, Physicians Health Center, we're a group of 5 medical centers in Miami-Dade, and we strictly practice occupational medicine. So very focused on working with employers to run a successful OCMED program, from the injury care, drug testing, physicals, and we have a very specialized program to the workplace. These are just a couple protocols that we have put in place since COVID-19, and it's just important to make sure that your medical facility that you're currently using has all of these protocols in place, because you want to make sure, again, if you are sending an employee to a center, that they are following proper guidelines. One thing that we're offering is we're allowing employees to wait in their vehicle for a medical visit. So if they are not at the moment where they're going to go see the doctor, we will call them on their cell phone and direct them right in at the time of the start of their appointment. We're doing temperature checks on everyone at the facility. Face masks are required when entering in the medical center. Social distancing is in place as far as signage and separation of chairs. There's additional detailed cleaning. And we've also included telehealth as now an option for medical visits. So new injuries and follow-up care can be done via telehealth for workers' comp visits. So it's something new that we're offering. We still have the option, any employee can come to us in person, but you do now have a choice of having an employee doing their visit virtually. And after this, I can assist anyone if they want to set up protocols with our company. So let's get into it. Let's discuss some precautionary measures regarding COVID-19. So let's just begin by identifying if you are feeling flu-like symptoms such as fever, coughing, shortness of breath, you need to contact your primary care physician before reporting to work. So you don't want to just show up to the hotel if you do have these symptoms. It's very important that you do get a test and let your employer know that this is what's going on so that they're aware of it, and that you're also monitoring and making sure that you don't have an active infection. The resources on here can be used to find a testing site. There's an 866 number that can be dialed, and they'll give you a local site you can go to for a COVID-19 test. There's also an email, and there are several resources out there that you can search for, and I also can provide you if you need any of the testing sites that are set up in Miami. So just some of the symptoms that we're looking out for. They usually are onset between 2 to 14 days after exposure to the virus. They include coughing, shortness of breath, fever, chills, muscle pains, sore throat, a loss of taste or smell, chills, a headache. These are all signs of a possible COVID-19 infection. So to help return your employees back to work, there are 3 testing options that are mostly being done. The first is doing the COVID-19 actual viral test, which is for an active infection of COVID-19. They're also doing antibody testing. Currently, they're stating that the antibody test is not a good indicator for returning to work because it doesn't really say you can't get the virus again. It tells you if you've had a previous exposure and you've built up the antibodies, but currently it's not viable for stating if the employee is safe to work. Another thing that's being done is return to work questionnaires, where employers are asking employees a series of questions prior to their work shift, prior to the start of the work week, just asking them, do you have symptoms? Have you been exposed to someone who is COVID-19 positive? Have you traveled somewhere where there's a high positive rate? So these are things that you can do, but again, let's just explore the legality of doing some of these tests.
Again, good afternoon to everybody. Let's talk about what the can and cannot do. An employer can 100% ask an employee whether they've been to an affected area, they live with someone that's affected. They can ask the questionnaire if they're feeling any of the symptoms that Zach mentioned early on. Once you do that, I want you to bear in mind that the 14-day waiting period, quarantine period, however you want to refer to it, is not a hard and fast rule. That's a suggestion. There are people that are testing positive and have it for months. So bear in mind that just because somebody has 1, 2, 3, 4 of these symptoms and they are presumptively positive, just because you wait the 14-day periods is not a hard and fast rule. Best suggestion, testing. And Zach is 100% correct. The antibody test is insufficient to protect your employees. Remember, there's something in OSHA called the general duty clause, which is you as an employer must protect your employees from known risks. You have somebody that is presumptively positive or has tested positive, and we'll go into this in a little greater length in a little bit, you need a negative test, you need a doctor's note to come back. You need to make sure that this person is safe to re-enter your facility, and it applies across the board. Should you have somebody that is presumptively positive, somebody that has symptoms, somebody that reports to you that, yes, I have tested positive, you are well within your right to disclose that to a public health agency. You may not disclose it to fellow employees. You cannot tell a fellow employee or somebody without a need to know that John Jones has tested positive for COVID. I'm positive the employees will figure it out on their own when John Jones isn't there for 2 weeks, but for the most part, that cannot come out of the employer. That's privileged medical information and cannot be disclosed.
Okay. So let's just move on here.
Now, new applicants. I get a lot of questions from employers, and this is primarily how it interrelates with the Americans with Disabilities Act. You cannot condition a new employee on getting COVID tested before you give them the job. That's putting the cart before the horse. And I know it sounds like semantics, but this is the way it has to be. If you're going to offer somebody a position, you make a conditional job offer on them filling out a medical questionnaire, not on completing a test. If the person completes the questionnaire and self-identifies as having one or more of the COVID factors, you're well within your right to say, go get tested. If the employer has an immediate need for that position, as you all are going to see as you're ramping up, occupancy is going to go from 0 to a number probably anywhere between 30, 40, 50%, and then in the coming months, hopefully greater. So you will have a definite need. If you have such a need and the person comes back positive, then you can withdraw the conditional job offer, because the person is tested positive, they cannot report for at least 14 days. You need to have the job filled, you withdraw the job offer.
Okay, so let's talk about on-site temperature checks or temperature checks at home for employees. Something that companies are doing now is before employees enter the job site, they're screening everyone's temperatures, seeing if they have a fever of 100.3 or higher, and then directing them home. So I know some of the legality to it is, can you do this? Can you not do it? I know some rules they have are it should be done right at the entrance to the work site so that employees are not walking around the job site and then doing a temperature check, finding out they have a fever. It also be done privately so that they're brought into an area where not everyone is seeing what's going on. So if there is a fever, not everyone knows that this employee just had a high fever. So those are a couple tips that I've been told about it, but let's hear a little more about the legality of it.
Like I mentioned a second ago, you can test. There's no issue with testing an employee. You can even keep a log to show that you did the testing. And John Jones, Zach is correct. You should not disclose if somebody has the benchmark 100.3, 100.4, depending on what source you look at. If somebody tests over that number, all you're going to say is, you're not able to enter the facility. Please self-quarantine or go get tested.
So we've already mentioned this, but let's just formally define. If you do have a positive COVID-19 test results, you do need to self-quarantine for 14 days, and you need 2 negative tests 24 hours apart before returning to work. So it's important that they do get 2 tests spaced out 24 hours, and once they have that second negative test, then they have the option to return back to work. So if you are at higher risk, that's another issue, is that if you're over the age of 65 or underlying medical conditions, you're at higher risk for contracting COVID-19 and having severe complications. So they say that if you are in this range, you need to really be following those precautions. But what's the legality of hiring someone who may be over 65 or have an underlying medical condition?
Here's where we start getting into very proactive employers. Employers that are wanting to protect people because they're older, because they know this person has a health condition, or because the woman is pregnant. You cannot self-help. And what's self-help? You can't say, Jane, Bob, or whatever, why don't you go on unemployment? Why don't you go out for 2 weeks because you're at greater risk? Protect yourself. You can't do that. The initiating source cannot be the employer when the employee has nothing. They haven't come with a high temperature. They're not showing, they look like walking death. You cannot go out and simply act on your own. You may have the best intentions in the world, but you can't do it. Hold back, let the person be the initiating source.
So when to seek emergency medical attention for COVID-19. So some of the symptoms that we're noticing: trouble breathing, persistent pain in the chest, confusion, unable to arouse or stay awake, noticing a bluish color in the lips or the face. These are all signs of having severe complications of COVID-19, and you do need to report to an emergency facility immediately. Make sure that the facility knows you're on your way. So if you're calling 911, they will alert the hospital. But don't just show up at the hospital without them being aware. That's the best practice. This may have changed. There might be some sites that are prepared, but it is best to let them know you're on your way. So preparing your work site. First thing to note, it's very specific to the industry. So there are specific guidelines in hospitality that need to be followed in order to successfully open your operations and minimize exposure. OSHA does have some guidance in their website as far as what to do in certain industries, so you can always review that. But there are also released by Miami-Dade County. They did release specific guidelines for hospitality, and if anyone needs that document, I could always share that. But I did include much content from there so that we can discuss it and really determine how everyone is implementing some of these best practices. So some of the things they mention is in hallways, having them going in one direction, staggering the arrival time of your employees, the days that they're going to start returning back to work, the days of the week they work, rotating the lunch period, making sure that employees are spaced out sufficiently, having employees wearing masks if they're within 6 feet and in common areas, trying to do meetings more virtually, checking the ventilation systems of your property. These are all things that you want to assess as you start returning back to work in the new norm. So let's talk about reasonable accommodations. Sergio?
All right. First, let's talk about, in the same vernacular, what a qualifying employee is. What is it when an employee comes to you and says, I can't do this? Well, first you got to find out under the ADA if the person is qualified. Do they have a disability that in turn requires you to provide reasonable accommodations? What's a reasonable accommodation? Reasonable accommodation is something that facilitates the employee doing their job. No, I don't want to go because I fear contracting the virus and I want to go home and eat bonbons and watch Oprah reruns all day long. No, that's not a reasonable accommodation. You have to, the employee has to be able to do their job. Let's give a for instance. The employee has taking some sort of medicine that immunosuppresses their body. They are less likely to fight infection. Well, To that type of person, you can accommodate by moving them away from guest interaction. You move them, you isolate them a little bit so that they can do their job. You do not have to accommodate somebody who can't do their job or is unwilling to do their job. We're finding a lot of people, and there's 3 separate issues that we've come up with. 1, I don't want to go back to work because I'm making too much on unemployment. We're seeing that in the hospitality industry. Again, that's not an accommodation you have to give. The person doesn't qualify for one. If they don't want to come back and they say, I'll call you when my unemployment runs out, you tell them good luck, apply again. Next one we see, no, I fear coming back to work. Person doesn't have a disability. They don't have an issue. They don't have anything that you must accommodate. Last one, well, I have a baby at home or I live with somebody that has or is susceptible to COVID-19. Again, not a qualifying criteria. There's nothing there that the employer has to accommodate. So generalized fear, whether it be for themselves or for somebody else, insufficient. With regard to COVID, an employer cannot self-help. That is the biggest thing I'm running up against. I'm also running up against employers that, when I use the word reasonable accommodation, they say, well, the employee never said that to me. The employee doesn't have to. The employee does not have to use trigger words or magic words of reasonable accommodation. You, as sophisticated employers, have to be able to read between the lines and determine that what this person is asking me for is an accommodation so they can do their job and accommodate their disability. Zach, that's pretty much.
Okay, so that was everything.
All in one shot.
Okay, so how to avoid exposure. This is both for the employees and the guests. So just, these are the key things. Social distancing, I know we've heard all these things before, but maintaining social distance for both the employees and the guests, following proper hand washing procedures, making sure to wash with soap for 20 seconds, using hand sanitizer, always covering your cough and sneezes, covering into your elbow if you don't have a tissue, and washing your hands right after. Being very mindful to avoid touching your eyes, nose, and mouth, specifically after you've touched a contaminated surface. So some types of acceptable reasonable accommodation upon return to work.
Again, you have an employee, they have a disability or are immunosuppressed, and folks, bear in mind that a disability can be physical, it can also be mental. We do have people that are under the care of a psychologist, psychiatrist, taking medication, high levels of anxiety, high levels of depression. These people, the COVID situation has rocked their boat big time. So you do have people, and you have to be sophisticated enough to recognize that this, in fact, is a disability that I have to deal with. Let's talk about what you can do. You can trim what I call the periphery of their duties. You don't necessarily remove them from their functions or create a new position for them, but you try to trim the edges off their obligations so that they can complete their most basic functions. We're also running up against people that have skin conditions and cannot wear masks because of irritations of their skin. That's something you have to deal with. People with latex allergies. Employer goes out and buys 50,000 boxes of latex gloves, and then they figure out that there's some employees that have latex allergies. That's a problem. So those are things that we're having to deal with on a day-to-day basis. An employer is well within his rights to require the employee to wear PPE, personal protective equipment. They're well within their rights to require sanitary standards, cleaning up their work sites, phones, computers, keyboards, their immediate areas, hand washing, promoting heavy hand washing when they use the restroom facilities or deal with the public. And an employee comes out and says, I don't want to wear gloves, they bother me, or you are well within your right to do so. That's something an employer can ask for and can pursue.
Okay. So let's just talk a little about face covering. So really any type of cloth or surgical mask is being used at the work site. Some of the tips for wearing it, making sure it fits snugly on the face, it has the ear loops, sometimes multiple layer fabrics will be better. Just make sure it doesn't restrict the breathing. They could be something that you could machine dry or just hand wash. But very important is you want to make sure it's covering the nose and the mouth. A lot of times I see people just wearing the face mask over their mouth, their nose is still exposed. It really defeats the purpose of even wearing the mask. When you're in close proximity to other people, that's the parts of exposure we're trying to avoid. So again, it's very important if you notice an employee that's not wearing the face mask correctly that you do correct them. Wearing it on your chin or hanging down, also touching the front of the face mask can cause more of an exposure and then if you're not even wearing it. So again, just make sure that everyone is wearing the mask correctly. So another key thing is going to be sanitation and cleaning frequently touched surfaces. So you want to have someone that's monitoring areas that are being touched often. So a reception desk, the railings, elevator buttons, the bathrooms, those things need to be continuously cleaned. And we're going to talk about the specifics of how often they need to be cleaned. But again, start identifying highly touched surfaces at the work site and make sure that there's someone designated to keeping those clean. Another thing, just general, is to offer contactless payment. So try to offer ways where you don't have to exchange money or touch a credit card, seeing if you can implement a contactless payment system in your hotel. Another thing I just want to touch on is offering meals. So I know a lot of hospitality hotels, they offer employee lunches. They are recommending or stating that you need to provide individually packed meals. You can no longer have an open buffet area where anyone can just come up and start grabbing stuff. You need to keep things individualized. The same goes for if you have a restaurant in your hotel. The menu should be disposable or digital. I know when I went to a restaurant, they actually have that QR code on like the table, and you just scan it with your smartphone, and then it brings up the menu on their cell phone. So that's another way to do it. So get creative, but just make sure you don't have open food areas. Also, the dividers are also very important. Make sure you have plexiglass dividers at the check-in area. Wherever you have face-to-face contact, it adds another layer, another barrier to avoid exposure. Also, making sure that in both the front of the house and the heart of the house, you have signage, hand sanitizing stations, making sure everyone knows which direction to walk down a hallway, that people are keeping 6 feet apart. Have this visible throughout your property. Make sure there's nowhere where there's an area where people can congregate and there's nothing that's stating they can't do it. So this is just some other employee guidelines. Sergio, I don't know if you want to jump in on this. This is a new section. So the first thing was about hotels with displaced employees, that they have to hire those first.
Right, here we're getting into the CARES Act, and the CARES Act has many, many tentacles in it. I'll gladly address CARES Act questions offline with anybody that has them, because there are deadlines that some are gone, some are coming, and some are extending to when you have to bring employees back. This is more to the extent of people that are either working very reduced schedules, working remote, and are then coming back on site. That's the principal focus here.
Okay. So something else very important is making sure you have supervisor and management monitoring that everything is being followed as far as your safe health and safety protocols. They're stating that in the hotels, things need to be cleaned and sanitized every 4 hours. Employees are given instructions every 2 months on how to respond and report a presumed COVID-19 exposure. The training should be provided in English, Spanish, and Creole if the hotel maintains a large staff population of that background. So make sure that if you do have a group of employees that speak other languages, that you are providing the trainings to them in their native language. So some other things specific to hospitality. I see that they're stating currently no pets are allowed in guest rooms. I believe certain service animals, if they have designations, they can be, but just having pets in the rooms are not acceptable at this time. Staff must wash hands with soap and water or use sanitizer every 2 hours. So they're saying every 2 hours your employees should be sanitizing. Also, valet will not be an option where there's on-site parking. So if you do have parking available, they're saying to not provide valet, but if you're in a site where that's the only option, it will be allowed.
Guys, Zach, if I can interrupt you 1 second on the no pets issue. Folks, keep in mind that a support animal, there's two types. There's a service animal and an emotional support animal. Those are two different things. A service animal is one that takes the part of an important bodily function, a sight dog for a blind person. Those are not considered pets. Those are almost property to the extent that you cannot keep somebody or tell somebody they can't come in with that animal. They can use the property. You can't stop them from using the property. Service animals are just like a human being, and they're treated that way. Now, emotional support animals, the people walking around with little Yorkies that have the little phrase on them that says service animal, those are not true service animals. Those are emotional support animals. They're not given the same benefits. So make sure you treat them separately in public accommodations and under the fair housing discrimination laws. Service emotional support animals can be treated, but not always. So just bear in mind there is a distinction.
Good to clarify that. So guest sanitation. So each guest will receive a COVID-19 awareness information. This can be provided digitally, so you can email these to your guests. If able to be sourced, a spray bottle or sanitizer wipes should be provided in each guest room. So if you're able to have that available in each room when they check in. So this is just specifically on elevators. So there are a lot of regulations as far as how to conduct your elevators to minimize exposure. So an employee will sanitize the button panel at least once per hour. You'll have signage that will be posted explaining what the current procedures are. Those safe distancing guidelines will be there for each elevator specifically. If able to be sourced, providing hand sanitizer or some way of sanitizing at each elevator station. Elevators includes markings on the elevators and the floor identifying where to stand. Everyone keeping 3 feet apart in the elevators unless they're part of the same family. And of course, everyone wearing the face coverings in the elevators. So those were the guidelines that they gave to hospitality for your different elevators. Another thing let's talk on is guest check-in. The first state, which seems to be a legal term, is employees who self-identify as high risk should be reassigned if possible. So Sergio, is that accurate that they should be reassigned if they identify?
I don't like the word reassign because it's not 100% accurate. An employee who self-identifies as high risk, if they ask for some type of accommodation, the person who's undergoing cancer treatment and has a weakened immune system, yes, that person they can be accommodated so that they can perform their job, but they don't have to be reassigned completely unless there's an opening somewhere that they can. You don't have to create a position for that person. They have to be able to do their essential job. They just may have to do it in another way or be facilitated in such a way to do it in another way. But for the most part, reassigned is very, very broad and it's over-encompassing.
Okay. So as for guest check-in, make sure that it's staggered, not everyone just arriving at the same time in the lobby, having one person go up to the front desk as opposed to a large group, trying to encourage virtual or remote check-in, and then having the reception area with a medical kit on site. So that was the content we had. So I think there were several questions that were posed in the chat. So what I'm going to do now is I'm going to open up the video and audio of our panelists. So any of the panelists, if you want to go ahead and share your video and audio. Leonie, are you there?
Hello? Yes, I'm here.
Okay. So yes.
We have one question.
So, and Leonie, I think you got.
All right, no, okay, so we do have a question from Helen. And what she would like to know is, what would be the best practice for individuals that are returning from furlough? So that's the first question that we have here.
So Sergio, if you want to.
That's a huge question, but best practice, let's start with the most basic levels. 1, the questionnaire. 2, temperature checks. I have 4 hotels on the beach that I represent that are high end, and they are actually providing and paying for testing of all returning employees. So that's employer dependent. That is, what can the employer do? We can do self-help questionnaire, self-identifying questionnaires, temperature checks, that's at a basic level. Second, will the employer test everybody? And if so, how often will those people be retested? That's all employer dependent. It's how much money is the employer able to absorb to bring people back.
So it looks like Isabel is asking to discuss more on the CARES Act.
Yeah.
I don't know if there's any other general comments, or, I mean, I'm sure you could definitely, I know Isabel, Sergio will be willing to have a separate conversation with, but is there anything general, Sergio, you'd like to bring up on the topic?
Guys, the CARES Act it's 2 separate acts within itself. We could do another couple hours just on CARES Act itself. If anybody has a question, you can email me. My email address is Sergio C, my last initial C, at MKRS.com. We can call me. Information is on the website, MKRS.com, and we service the entire state. So I'll be more than happy to walk you through the basic bullet points, but I can do another couple hours just on the CARES Act.
Okay, so are there anyone that wants to make any comments? What I could do is I could go ahead and open up the video and audio if anyone wants to show their face and say hi to everyone. We do have like 35 people on the call right now, and I do see a lot of familiar names. So hopefully what we'll do is, as soon as things start getting back to normal, we'll be able to go back into a normal setting and be able to be in person at a hotel and have a nice meal together. But in the time being, we're going to continue doing our virtual meetings. We'll try to come up with different formats for the future. I know this one was more of a webinar, so we don't have everyone viewable, but we could try looking at doing something where everyone gains video and audio access and we could have a big conversation. Not sure how it will go because there'll be so many of us, but it could be fun. So we'll brainstorm and decide what we'll do for our next meeting, but I think this was a good way to initiate it, let everyone hear some topics that are very relevant right now, and just give us a chance to have a forum to discuss this. So if there's any questions after this, please direct it to one of the panelists, one of the board members. We'll send out an email if there's something that we want to express to everyone. We will share it with everyone, the PowerPoint that we just went over. So if everyone wants a copy of it, we'll send that out to the members.
Zach, about HR credits.
Oh yeah, so one other thing is that Physicians Health Center is hosting our first Emerging Trends as a webinar. It's going to be next Friday, and we have an excellent set of presentations. It's going to be 3-hour training, and we are offering HRCI credit hours, so you will get 3 credit hours for attending. So if anyone needs the link, it was sent out through the association, but you can reach out to me, and I'll be able to get you there. We have over 200 registrants. It's going to be a big event. So you definitely don't want to miss it. And all of you are welcome to join us for that event, and there's no cost to it. So I think with that, if there's no other questions, I think we'll end it there. And it was great getting to present to everyone, and at least the board members, you got to see our faces. But we will try to do a meeting where everyone has a chance to speak and have kind of like an open roundtable discussion. I think it just would have been a little too much to have 30 people all on the screen at once and everyone trying to talk. I'm not sure how it works in a Zoom setting.
We'll be able to do it.
Okay,
Yeah.
Yeah.
Thank you, Zach, for all of your work in putting this together and the presentation.
Yeah.
And I just want to say that we will keep communicating to everyone via email as to what our coming events will be. And if we plan another meeting like this next month, you will receive the information as well. But hopefully we can see you all very soon. Thank you.
Okay, thank you everyone.
Thank you, Zach.
Thank
Thank
you. Great.